Right, so as Soa pointed out, with transmissions slowing and vaccinations rising, health authorities here are poised to push ahead with their exit plan from the pandemic come next month. And for more on this, I have our Kim Yeon-seung here. As always, Yeon-seung, welcome back.
Happy to be here.
Right, so let's begin with some updates regarding our transition into normality.
Well, until now, the details of this living with COVID-19 scheme was kind of cloaked in mystery, but Prime Minister Kim Boo-kyum dropped some hints on what this scheme is going to look like. He said that they'll start by loosening restrictions for businesses that have taken the biggest hit from COVID-19 and those that present a relatively low risk of virus transmissions. He has yet to specify which businesses, but we can infer that the plan is going to focus on small and local establishments, as well as those in the travel or cultural sectors. Actually, some city governments are already taking their own initiative to revive the tourism industry. Like the city of Sejong, for instance, they're bringing back their city bus tours for the first time since July. But the Prime Minister also warned the public that now is not the time to rush into hasty action. Take a listen to what he said.
When we see the experiences of other countries, it's clear that this situation is a moment of crisis with hope. It's a challenging task we have to prepare meticulously. We have to carefully take it step by step as we head down this unknown path.
More details on this plan are to be announced during a public hearing next Monday. They'll also be soliciting feedback on ways to ease social distancing measures while staying vigilant in stopping the virus.
Right. Yeon-seung, do tell us a bit more about the Prime Minister's reference to the experience of other countries.
Well, it is concerning because some countries that have already pressed ahead with the living with COVID-19 scheme are seeing record surges within their COVID-19 infections. For example, UK topped 50,000 cases for the first time in 3 months. The surge there was partly fueled by a newly identified variant. And now this strain is a spin-off from the Delta, and it's sparking concern over whether this strain is more transmissible and more resistant to the vaccines than the Delta. This variant has also been found in Israel as well. Russia is seeing record deaths and cases, and President Putin actually responded to this by ordering a 9-day-long shutdown in workplaces. Singapore's health system is overwhelmed with a majority of their isolation rooms and ICUs filled as well. So this surge is rather surprising, considering that COVID-19 cases worldwide have actually been on the decline for the last 7 weeks. Top WHO official Mike Ryan on Thursday actually attributes this surge to the eased COVID-19 restrictions. He says that there has been an increase of indoor social gatherings that came with a drop in outdoor temperatures. So you can see why South Korea is trying to tread lightly with these COVID-19 measures.
Right. And I suppose the resurgences in the countries that you mentioned, the UK, Russia, Singapore, they're putting perhaps a very heavy toll on frontline healthcare workers.
Exactly. And I'm glad that you mentioned the healthcare workers because there was actually a very grim report released by WHO as of Thursday. The WHO estimates that this virus could have killed 80 to 180,000 healthcare workers between January and last year and May of 2021. And along with this figure, the WHO highlighted the growing vaccine discrepancy between low and high income countries. 8 in 10 healthcare workers have been vaccinated in high income countries. In contrast, fewer than 1 in 10 healthcare workers were vaccinated in Africa. A senior WHO official warned that this could cause the pandemic to drag into next year, and it's imperative that vaccines are evenly distributed throughout healthcare workers in low-income countries as well.
Of course, because we are fighting a global health crisis. All right, Yeon-seung, thank you for now, but stay with us for the extended talk.
Thank you.